That dull ache or sharp shooting pain in your back can significantly impact your daily life. Back pain is the second most common reason people visit their healthcare providers. What's causing the pain in my back? Tonight, on Call with the Prairie Doc.
Welcome to On Call with the Prairie Doc. Health information based on science, built on trust. I'm your Prairie Doc guest host, Carter Holm, and tonight we will be talking about back pain. Back pain is an incredibly common ailment that affects millions of people worldwide. Whether it's caused by poor posture, muscle strain, a sedentary lifestyle, or a more serious underlying condition, back pain can range from mild discomfort to debilitating agony. While many cases of back pain can be managed with rest, ice, and over-the-counter pain medications, there are instances where seeking medical help is necessary. If the pain is persistent and severe and affects your daily activities, it is important to consult a healthcare professional. Chronic back pain that doesn't improve with home remedies may indicate a more serious issue that requires medical attention. There is no need to suffer. Tonight, we will discuss causes of back pain, treatments, and why and when it is important to seek medical help. This evening, we are joined in the SDPB Black Hills studio by Dr. Tyler Ptacek, an interventional pain specialist from Rapid City Medical Center, Dr. Troy Gust, a board-certified neurosurgeon from Black Hills Orthopedic and Spine Center, and Dr. Bob McIntosh, a chiropractor from Health Source of Rapid City. Welcome, and thank you guys so much for joining me this evening. So, Dr. Ptacek, before we dive into our discussion, could you please share just a little bit about yourself and your background? What inspired you to pursue this work?
Sure, thanks, Carter. So I grew up in a small town in Nebraska. My dad was a family practice doc. I kind of saw what medicine was, and it was phenomenal to be able to become a part of patients' lives and then figure out a solution for them. So I trained in anesthesiology, and I fell in love on my chronic pain rotation, dealing with all types of chronic pain. Pain is such a debilitating condition, especially when patients feel like they don't have hope. So that's why I went into the field that I went into.
All right, thank you. Dr. Gust, tell us a little bit about your background and what brought you to where we are here at Rapid.
Yeah, thanks for inviting me. Mine's very similar. I grew up in a small town here in South Dakota, in Alexandria, South Dakota. I always had an interest in the sciences, and my drive to study what I do, especially surgery and the more attention to the nervous system, was led about by my dad having an accident and actually had a spinal cord injury.
Oh my goodness.
So back in the day, then I took a big interest in the neurosciences and went into medicine for that reason.
Yeah. Dr. McIntosh, tell us a little bit about your background and training.
You got it. I've been a chiropractor for 14 years, but before that, I used to be a diesel mechanic. And then through that time, I got to see industry. And then now, as far as going back to school, I was able to see how to apply that to industry as well. And so when I started going through chiropractic school, I've had multiple injuries to my back and even a snowboard crash where I ended up hitting my head. And so I got to apply the things I was learning and understanding, but then also be able to help deliver that care to other people so that they were able to see it from not just here's the books and what they do, but this is what I've gone through as well.
It seems like we share things in common. My father was also a doctor who inspired me to go into medicine, and seeing, experiencing pain in your family, pain in your own experience, pushing you forward. I really appreciate that. My first question is an incredibly broad one, and so I'm going to give you all an opportunity to answer. What are some of the most common treatments for back pain? Dr. Ptacek, would you want to answer first?
Sure, so that is a really wide question. I think it depends on what is causing the pain or how long the pain's been there. So for example, there are really scary things that can cause back pain, such as cancer in the spine. There can be a fracture in the spine with a traumatic accident. There could be something as simple as a muscle sprain. So it all comes down to trying to figure out how serious this is, how long it's been there, and what are the other symptoms associated with it. Pending that, I mean, my most common referral is for conservative care, chiropractic and physical therapy. That treats 99% of patients who have back pain.
Dr. Gust, what are your most common treatments?
Yeah, I would agree with Dr. Ptacek. You know, we see an awful lot of patients that have back pain, whether it be acute, whether it be chronic. I think the key is separating issues that might need more of attention from a surgery perspective, which is what I do. But the majority of patients will get better, if not totally resolved of their symptoms, with chiropractic care, physical therapy, anti-inflammatories, analgesics, exercise, some basic conservative things. So that's typically offered to every patient, with the exception of very few initially when I see them.
Sure. Dr. McIntosh, what are some early treatments that you see for back pain?
Early treatments in my office, or
Sure,
even?
yeah.
Okay, so in our office, we use multiple modalities, and so it's going to be on the side of chiropractic adjustment. We do rehab or exercise to be able to strengthen the area around it. There's procedures, laser, class 4 lasers, electric stim, spinal decompression. And then we also do a lot of curve correction for like spine problems that are degenerated or have an abnormal curve, so you can fix the shape of the spine as well. So that's common, but I would say even before that, as far as being able to understand what's important to know about back pain and there's so many different types. So there's lots of treatments.
And I would say, sorry to butt in, but it's the most important thing is to not do nothing. So to lay in bed for 2 weeks is probably one of the worst things you could do for back pain. So do something, try to maintain mobility, try to maintain, being able to walk and take care of yourself. I think doing that early in the course is very important.
Because it's scary. As a patient, I mean, when you have a back problem, you don't know what to do. So a lot of times you'll have patients who go to urgent care or go to ER, and it's not often the place for them too.
I was very early in my healthcare career working as a CNA in a nursing home and lifting some of these heavier patients, rolling some heavier gentlemen. I noticed some lower back pain, and it's frightening. When you haven't had this pain experience, you don't know what to do. I called my dad, and he said, well, have you tried ibuprofen? And so to start with the very basics, anti-inflammatory medications, moving up. My next question for you, Dr. Ptacek, is more specific with physical therapy. How does that help people with back pain?
Physical therapy is incredibly important just to get moving into normal patterns. So what I see typically in my pain clinic is the result of not doing the correct things because of a thing called kinesiophobia, or patients get afraid to move properly. So getting back into that normal function is really important. One of the conditions that I see very commonly, and there's new treatments for it, is called multifidi atrophy. They're the small muscles that attach to the back of the spine. And those muscles, if you don't use them correctly and rehab them quickly, they basically go away. And that really impacts patients' function, and we think it can start the degenerative cascade. So we think it starts arthritis and disc problems later in life.
If you don't use it, you lose it.
Correct.
All right. Any specific exercises, Dr. Gust, that you use with patients before you have to move on to something more serious?
And I think that varies depending upon whether or not your chiropractor does a lot of physical therapy modalities in their clinic, or you go to a registered physical therapist. But those vary, and each of them have different responses based on their success with their own patients. But what we see a lot of, especially those that come to our spine clinic when they've kind of failed conservative management, is issues with posture and core strength and mobilization and gait training. So I really feel that by restoring posture is probably one of the most beneficial things that patients need in order to reduce pain.
Yeah. All right, Dr. McIntosh, can you tell me a little bit about acupuncture, and is this a viable treatment option for back pain?
As much as I've been around it, I'm not trained in it. I've sent lots of patients for it, and they do get great results. And there's different types. You have dry needling and you have acupuncture. So still using the same tools, but different ideas or different mindsets. And so acupuncture, I mean, you can be needling different areas, ears, hands for back pain. Yeah. And it still helps these patients. I mean, there's spots as far as that'll block pain in the rest of the body. And so I honestly, acupuncture, it's results-wise is great. I don't know how to explain all the meridians and, I really don't.
Yeah.
Well, that's a specialty in itself.
Yeah, it really is.
Folks that do acupuncture, and I have numerous patients in the clinic ask about acupuncture, and certainly I've seen the same thing. And what Bob has mentioned, that patients can get great results for that, and so more power to them. So I do think that there's a niche of people that will respond positively to acupuncture, and if so, go do it.
Now, this is kind of a follow-up, and any of the three of you I'd be interested to hear, but along that same line, like just massage therapy to help relieve some of that back pain. Is that something that you...
So I'll send a lot of patients out for massage, whether there's been some sort of trauma or it's just chronic back pain, because just getting tissues to start working again is helpful, or even just the mechanoreceptors are nerve endings that sense pressure. But when they start getting activated, they actually block pain for the patient too. And so then they can start to understand movement is okay, those types of things, or spasms reduce in their back or neck. So.
Next, Dr. Ptacek, I would ask about, we've talked about exercise, some of these, over-the-counter medications, massage. What other medications are used to treat back pain?
Sure. Great question. And we have a lot of different medicines in our toolbox to help patients, but we have medicines that mostly focus on nociceptive pain, or pain coming from muscle and joint, and we have medicines that focus on neuropathic pain, or pain coming from nerves. So patients who have pain coming from nerves, they typically would have some sort of compression, some nerve irritation in the back, and we would use medicines that target that specifically. The other medicines are typically anti-inflammatories or muscle relaxers to help break the cycle of pain. So,
on my rehab unit in Sioux Falls, gabapentin is pretty widespread, and then Robaxin, which gabapentin helps with nerve pain, and then Robaxin as a muscle relaxer. Is that something that you feel comfortable prescribing for most patients?
I would say gabapentin is probably my top 2 medicine I prescribe, and Robaxin, tizanidine, cyclobenzaprine, all muscle relaxers are very common in aiding patients to get through their episodes.
Dr. Gust, can we talk maybe a little bit about the factor of weight and what that causes in back pain? Do we see a greater instance of back pain in patients who are heavier?
Certainly. I think there is a relationship to it. And what we notice is that when we are carrying extra weight, whether it be 5 pounds, 10 pounds, 15 pounds, it also depends upon your height and whether or not you have an active exercise regimen. But we do know that carrying excess weight creates problems with our joints, and that includes joints in the spine, which is our facet joints. And these things get loaded. They develop arthritis early on that creates pain generators. We also know that carrying excess weight in our discs make the discs dehydrate. And when they dehydrate, they lose their cushion effect, if you will,
right,
and they become problematic and painful. So yes, we encourage folks that are carrying a little extra weight to try to reduce that the best they can, whether that be through exercise or better nutrition or both. And we will see a reduction in back pain overall.
I find it fascinating every time we talk about a specific health issue, it does come back to exercise, nutrition, and overall wellness. Question for you, Dr. McIntosh, about stress. Do you notice stress as a contributor to back pain?
Great question. I believe not just in patients, but also I was at a conference, and this conference was this farmer rancher was talking about how when you take your cattle or your pigs to market, and if you have to haul them a long distance, what happens is if they have to go versus a short distance, the ones that actually travel the long distance have a shorter shelf life once they're butchered because of the tissue breakdown faster. It's about half. So you take muscles, fat, ligaments, joints, and the cattle that are traveling that longer distance, it's broke down chemically because of the stress of travel. Yeah. Shorter ones, longer shelf life.
That's interesting. So we do see the connection.
For sure.
That's very interesting.
There is a really important mind-body connection, and I would have a book to recommend for anybody watching. It's the author is Dr. John Sarno, and it's called The Mind-Body Connection, and it basically talks about how stress can shut down body functions, and if you can control that, you can fix pain.
All right.
It does. It upregulates your blood sugar.
Yep.
And so when your blood sugar's high, you can't heal as well. It's just like being diabetes or diabetic. And so you can't heal. You physically can't heal as fast.
And when your stress level's high, many patients become depressed. What happens when you go through depression? Your exercise tolerance goes down.
And
your posture gets terrible. Your nutrition goes away. You gain weight. Your problem gets worse. It's a circling effect that we see a lot in disorders of the spine.
All right, thank you guys. A herniated disc is also known as a slipped, ruptured, or bulging disc. It's one of the most common causes of neck, back, and leg pain. Prairie Doc visited with the Orthopedic Institute to discuss what is a herniated disc and what are some treatment options.
Dr. Greg Alvine is a doctor for Orthopedic Institute in Sioux Falls, and he helps patients of all ages who have herniated discs on their spines.
And you can get a weak area in that spine, and the nucleus will push out and herniate, we call that, or protrude, and into the canal onto a nerve.
Dr. Alvine says patients who have a herniated disc may experience pain in their back and more pain shooting down their leg. The source of the pain originates from stress on the back, causing a disc to slip, putting pressure on a nerve. An MRI scan is needed to diagnose a herniated disc.
The gold standard for diagnosis is an MRI scan, and that will look inside your spine, look at the discs and the nerve roots and the bone and so forth, and you can diagnose it that way definitively.
After the diagnosis, patients are given medication and sent to physical therapy to help manage the pain. Dr. Alvine says herniated discs take time to heal, and our bodies have a remarkable ability to heal themselves.
I use the analogy where it has a consistency of crab meat, and it will scar back eventually with time and free the nerve up again.
Dr. Alvine says if the body isn't feeling better after 6 weeks, surgery is recommended.
So typically what we do is a microdiscectomy, where you make a small incision and you bring a microscope in and you take a little window of bone around the back of the spine and you find that disc fragment and you pull it off the nerve.
The surgery is a same-day procedure followed by a few weeks of physical therapy. Dr. Alvine tells patients to avoid any lifting, bending, or twisting of the back. Although you can't prevent a herniated disc, there are ways to help your back.
You can be cognizant, good body mechanics, how you lift things, for example. Lift things close to your body, not over a fence. Good body mechanics can protect your back.
Dr. Gust, what is fused disc surgery?
Well, that's kind of a loaded question, if you will, but we can do fusions for numerous reasons, whether that be in the neck, whether that be in the mid-thoracic spine or the lumbar spine. There are some conditions where we recommend fusions, and those are usually related to an instability, meaning that two bones are moving out of proportion to one another, and they shouldn't be. Whether that be degenerative, whether that be related to trauma, fracture, or cancer, those are usually the real indications for fusion surgery. Typically, we don't do fusion surgery for just pain in itself, unless we've exhausted all different types of conservative treatments, chiropractic care, pain management options, injections, blocks, etc.
These are not elective. These
are kind of the last ditch effort when patients have tried everything else and have failed. What it really means is we take out a disc or the cushion between two bones, and we substitute that with a grafting material, either the patient's own bone or a cadaveric bone, and then we put a device in there to stabilize that joint. And ultimately what we want it to happen is bone to grow through those devices and fuse two bones together, in theory to reduce pain.
Yeah.
That's a simple way of describing a fusion surgery.
Now a follow-up, Dr. Ptacek, in my field, rehab, we're getting these patients post-op, and nearly always they have the requirement of some sort of brace, like a TLSO brace or an Aspen collar. Can you tell us a little bit about why those braces are used?
Sure. So with the fusion surgeries that Dr. Gust was talking about, they want it to be successful. And part of the success process is to not disrupt the fusion bed. So they want stability there so the bone has a chance to grow through it. So there's a few things that we do. Bracing, trying to get into a walking routine to load the bones, and then to avoid certain things like smoking. So smoking is terrible for spinal fusions and for healing in general.
So smoking worsens back pain. That doesn't seem necessarily like a cause and effect, but can you tell me a little bit about more why that would lead to that?
Sure. So smoking decreases blood flow everywhere, including wounds that are trying to heal. It prevents new blood vessels from growing. It causes the little blood flow to the disc that we get to not be there, so it can cause degeneration faster. So smoking by far is one common factor that I see that is really impacting my patients, is smoking.
It's interesting.
Yeah, and in that same regard, post-surgery, when we do fusion surgery, we also know that if patients haven't stopped smoking or they continue to smoke, we tend to see a more of a non-union, and what that means is the bone bed didn't heal correctly, and therefore the patient's pain does not get better. So it's a big risk, and we really encourage patients, unless there's an absolute emergency type surgery that needs to be performed, to be off smoking for a period of time.
That's interesting. That's interesting. So, Dr. McIntosh, can you tell me a little bit more about the role inflammation plays and what can be done to combat that?
So inflammation can come from injured tissue, so more of an acute process. You can have inflammation from like trauma, but then there's a lot of inflammation in the spine if there's abnormal motion. And so one of the things is being able to figure out what this inflammation source is. But then when you figure it out, how do you approach it with, whether it's nutrition, with medications, with movement, with laser, what modalities end up helping rid the body of it the fastest and be able to mitigate pain for them? I think the cool part with especially the docs that are here is there can be so many different inflammation generators. It can be the disc, it can be the facets, it can be the ligaments around it. And we were talking about weight, heavier weight. You take a person that's heavy set and their torso leans backwards and it sets all the pressure on the joints and the backside of the spine, and they shouldn't be bearing all that weight, and causes or keeps generating more and more inflammation. So weight, you have to figure out what's causing it. Sometimes it's not just that one area, but then a lot of providers will take and just shoot steroids at it and cut inflammation in that whole process right there, but they didn't fix the causing effect of it and change the load on those tissues that are hurting. So, and I believe that because nutrition is a key component. We know that being able to mitigate or reduce the types of foods that we eat that bring on inflammation will help reduce inflammation. It can be the types of oils we eat that are a source of it. It can be grains that we eat. And almost always it's excess in a lot of that, you know what I mean?
So in following up with finding a specific cause of an inflammation in a specific area, Can we talk a little bit about like ergonomic changes or like workplace changes? If somebody comes in and they're having a specific lower back pain, and maybe you can trace it to this guy's a CNA lifting heavy patients, or what are some, Dr. Gust, what are some specific workplace adjustments?
Yeah, that is important. We see a fair bit of back pain and neck pain with patients that are obviously physical laborers, i.e. construction workers, people that are standing on hard surfaces all day long with inability to change postures. We see it in bad mechanics. We see it in hairdressers standing. And what they're doing is axial loading the discs or the facet joints and wear and tear over time. So that is one instance for people that have to stand and do physical stuff. But we also see it ergonomically in people sitting at a desk that have a computer like this, and their posture's bad. So they get neck pain, neck strain, their shoulders hurt. We see terrible posture and appearance on x-rays. So we might recommend changing a desk, for instance, at their workplace. We may say, get a pad for your floor at the salon and stand on that when you're doing hair. Mm-hmm. And that's so much, this is more of these guys, what they end up doing, but we hear that in our clinics as, talking about surgery or not. So I do think that posture is important, and ergonomics play a vital role in neck and back pain, certainly.
Well, one of the big, as far as measurements for outcomes, is sagittal balance and coronal balance. And if there is like surgical intervention, if there can be a procedure that's done to improve that sagittal or that coronal balance, then they have better outcomes, right?
Correct.
So going from the workplace ergonomics to going home, what about poor mattresses or poor pillows? What does the quality of a mattress maybe contribute to back pain? And what are some recommendations maybe for improving?
Sure. That's a great question. I mean, I would say first and foremost, everybody's different. Sometimes people sleep on their belly, sometimes people sleep on their back or their side, so that would depend on the type of mattress you have or what firmness is. I would say that in general, it's very specific to that person, but usually you want to have the spine in a neutral posture when you're sleeping for 8 hours a night. If you're waking up consistently with back pain or consistently with neck pain, then you should probably visit with somebody who actually knows about mattresses to try to find a better solution for you.
Okay. And on that line, I would just add one thing. Let's not forget about our shoes.
Yeah,
right?
Sure.
We hear this, and shoes play an important role on spinal pain too, because when we're not wearing good soled shoes or shoes with good soles in them for cushion, it can lead to lower back pain.
No paid sponsors, but I wear Hoka's at work that have very
nice shoes,
a very good cushion. Are you guys also?
I'm on that very same line. I wear very nice shoes, and I rotate them out every 3 to 6 months. But it is somewhat. It's somewhat alarming to see people walking in with back pain and they're wearing flip-flops or they're wearing high heels and their SI joints hurt, things like that. So shoe wear is very important.
What about like lifting? Different lifting techniques or different things at work that might cause back pain. What do you recommend for people who need to do more heavy labor at work?
So when I go on site to the work site and teach people how to lift, they also need to know why. Mm-hmm. And when you're lifting an object, there's leverage as far as when it's further away from you. And then if you have it closer, it's less weight to lift the object. People don't realize that this distance creates more work for your back.
Yeah.
So we've worked with the fire department for the last 5 years, and you take fire, they're out there as far as trying to help people, and they're in these awkward positions, and they get lots of injuries from these types of things. And because they don't have this ability to square up to the object, bring the object close, it's almost impossible. And so there's two sides of it. It's being able to understand why you lift, but then taking care of yourself so you're strong to lift in the chance that you have an abnormal lift position too, because it's not always ideal. It's just like the workstation, hunching forward, working on it, and working from home now since COVID. and hunched forward. Everybody's sitting their laptop, slumping in their chair, working on their laptop at home. And the amount of neck pain, back pain is crazy. But as far as lifting, it's always proximity. And it's always that it's squared up in front of you and that you're able to take and use your legs to be able to squat down. A lot of people's knees hurt, so they end up using their back. And so it creates other problems if they don't take care of themselves as a whole person too.
To echo what Dr. McIntosh was saying, I'll never forget it, but I had a patient that I saw in my clinic probably 5 years ago. But he was literally leaning forward to open a window, and he ruptured a disc out and needed emergency surgery because his leg was weak. So it's about getting things close to your spine and having good posture when you're lifting, for sure.
It's interesting to see in the clinic, and just something simple that I do with my patients that have back pain is I'll toss a pencil on the floor in front of them, say, pick the pencil up for me. And numerous, they will bend at the waist and lean over and pick it up instead of using the legs to support the spine to stand head up and stand up straight. So to Bob echoing what he stated, now think if that was 50 pounds
Right.
and not a pencil. It's a lot of strain on the back muscle.
Yeah. We actually use software that calculates how far a person is bent forward just in their posture, and it'll calculate their poundage. So on average, let's say it's a 16-pound head, and if it's a couple inches forward, it's now a 50-pound head. And neck carriage forward is one of the biggest predictors of neck, back, and shoulder pain.
So following in that line, how does spinal misalignment contribute to back pain, and what are some recommendations to correcting that alignment?
Sure. So we know that most of the spinal pain or spinal weight is carried on the disc, probably 70 to 80%. And when that's out of alignment, if it's shifted backwards, the facet's carrying that load. If it's shifting forward, the disc degenerates quicker. So it's important to have very good spinal alignment to prevent this whole degenerative cascade that we see when we're 60, 70, 80 and have bad backs because we were doing things for a long time the wrong way.
How does age play a role in back pain, and what are some age-specific recommendations preventing and treating that back pain? Dr. Gust.
Well, unfortunately, many things in medicine are related to age, right? As far as spinal health goes, all of us will be susceptible to arthritic changes in the spine. That's essentially, we all will experience some of that. But as we age, the important things are, again, nutrition, exercise regimen, keep loading the discs, keep your weight under control, and use appropriate mechanics when you're doing physical stuff. And really, other than, try not to get diabetes and don't smoke, you can't control your genetics, which is one component of it that if you have a genetic history in your family, that part you can't really control. But the other things, you try to maximize those things, and hopefully that limits or minimizes the amount of trouble you have with spinal pain overall.
Physical fitness.
Yeah. Important.
I think I get lucky because I see patients that are 80, 70 years old that aren't in pain. And they're in there to be able to take care of their spine. They may have had a little flare-ups here or there, but almost every single one of them walk 3 miles a day.
Yeah.
And
every single one.
To echo that, when you see one of these patients, and sometimes someone comes in and they're 82 years old and they come in and you ask them a question, "Do you ever had back pain?" "No, just for a couple of days." Very unusual. But yet, to echo his point, you look at the MRI scan, their discs look good, their facets look good, they don't have arthritis, and you ask their history. "Well, I've exercised for 40 years. I don't smoke. I watch my nutrition." These things relate, and you will see that.
So why does my back hurt when I sit? It's a question that anyone who works at a desk might ask themselves at some point. Sitting for prolonged periods of time can be a major cause of back pain. Prairie Doc spoke with a physical therapist about how we can limit back pain and sit more comfortably.
Ryan Otto is a physical therapist at Orthopedic Institute in Sioux Falls. He helps patients that struggle with their ergonomics. Otto says the spine is tall and straight, but many hours of slouching can put pressure on the spine.
And when we get out of those positions and we're in those, out of alignment positions for an extended period of time, what tends to happen is the tissue has to work a little bit harder. It starts to become a little irritated and symptomatic, and that's what starts to cause the problems.
Otto says the longer a person sits in poor posture, the more aches they will feel, potentially spreading lower to the legs.
As you start to develop these issues and you start to develop kind of that inflammation in the area, you start to get some muscle tension and muscle irritation as well too that can kind of add to that as well going forward.
When patients go to physical therapy for back pain, they start with an evaluation. After that, the physical therapist creates a list of stretches and exercises to help alleviate the pain.
Once we define that and we have a way to kind of shut off our pain and make it feel better, I usually get people into kind of a progressive core strengthening program, trying to build some strength and stability around the midsection. And then of course we're also, discussing ergonomics and proper body mechanics and just ways to try to avoid some of those irritators throughout the day.
Some jobs require sitting at a desk for several hours. Being stationary coupled with poor posture can cause serious back pain. Otto says proper ergonomics starts with sitting in a chair where a neutral spine position can be maintained.
Sitting in a chair that you can get your hips all the way to the back of, having some good lumbar support in place to keep your spine a little bit more upright can help maintain that neutral spine position. Chair height is important, so we want our hips to be slightly above our knees so that we're not sitting low and it starts to kind of round that back and a rounded spine position. And then getting up frequently. So if you're sitting for 2-3 hours at a time, even with a good neutral spine position, it's still going to be hard on that low back. And so we want to make sure that about every half hour we try to get up, we try to move around.
An underrated exercise that Otto recommends to help the spine and decrease back pain is walking.
That motion is lotion, right? It keeps everything just kind of fluid and moving, and it keeps everything healthy, and it's a very underrated exercise in my opinion, that if you can kind of develop a good daily walking routine of 20 to 30 minutes, it's a great way to not only improve spine health, but you're talking your overall health as well too.
Are there ways to remember to help keep that healthy posture throughout the day? What are some maybe reminders that you have for your patients? Dr. McIntosh.
Well, there's always the gadgets you can buy. You can place them on the upper part of your back and it tests the angle, the upper part of your back angle, and it'll cue you and vibrate. There's gadgets all over.
Interesting.
There's clothing that you can wear that's like something called IntelliSkin that physically holds your shoulder blades back, and then it has a vertical strip that pulls you upright, and so you wear it, and you wear them in sports as well, and it helps prevent injuries there. But just functional day to day, my best way to do it is I'll take an entire workforce and I'll go and I'll take their posture pictures or pictures from the side, and then I'll draw their points of their center of gravity and their hips, their shoulders, and their ear, and they don't realize how bad their posture is. They have no clue. And so we'll take that, and then we can actually follow that up and show them year after year that they get better because of awareness. And so it's always so that when you're talking to them, it's number one is awareness, and then they start to learn position of shoulders, they start to learn the position of their torso, and then get to understand where their ear is over their shoulders as well. Because you can have both sides of it. You can have patients that are or people that are really like too much, the opposite, yeah. And one of the other sides of it is they don't realize they're leaning off to one side. That's just as bad as having bad posture leaning forward. So awareness is number one, and then just giving them cues or little simple exercises to be able to correct themselves. A lot of times the low back support in our chairs is not meant to be used. You're supposed to be forward and up away from it. It's not intended for that purpose.
I think about the headrest in your car.
It's
and
horrible.
I'd never touched the thing.
Oh, jeez.
It's
a lot of the headrests now, they are too far forward, and so they take the impact and they force people forward, so you have to lean your seat backwards, and the headrest is then upright, and so you have this person that's slumped back naturally, and their head comes forward, so that's supporting a bad postural position for them.
Dr. Gust, how do you remind your patients to focus on posture,
Well,
to remember good posture?
I think it's more of a routine. And what happens is, and what you see in patients is, you teach them with what Bob had mentioned about, education. First of all, they got to understand why they're doing this. And then when they get comfortable and they start feeling better, they forget about that and bad habits resume. So it's more a mental reminder that you got to stay with this kind of stuff. Otherwise, what you gain, you lose. And then they have to start over. So it's more of a continuation of things that work. And when you feel better, don't stop, because your pain will return.
For real.
Yeah. Pain is the ultimate reminder. So,
Yeah.
But I mean, something I utilize on a day-to-day basis. So if my watch tells me I need to get up if I've been sitting for longer than 45 minutes. Just certain things like that can really prompt you, like, hey, you need to start moving. I tell a lot of my patients we're born in a flex position, and as we age, we get in a flex position, and everything we do during that day should be to try to get back to it in extended position, to try to reset our bad habits with sitting and being in that position for a long time.
In the middle part of our life, we've got to be straight.
Correct.
We've got to maintain that. I like that.
Correct.
Let's talk a little bit about a patient who maybe had a past traumatic injury or a past sports injury, for example, when they were younger. How does that maybe affect a person later on in life? And is that something that you see commonly? Someone coming in and say, "Oh, I had this football accident 30 years ago," or
car crashes.
Yeah, I see a lot of people who've had a pretty traumatic injury, like either a broken bone in some part of their body, or a pretty significant injury where they needed surgery. And I would comment that when you're young, the body has a remarkable ability to remold. I mean, there are new body mechanics, but if they adjust to it quickly, it's pretty amazing to see how well they do 30, 40 years past that. Now, there's other things like car accidents that we see all the time with whiplash that can cause some pretty significant things if they're not treated quickly.
I think I would be remiss in this area of the state if I didn't mention motorcycles. Do we see an increase in back pain issues when Sturgis Rally comes around? Or can you talk about motorcycles, Dr. Gust?
Well, certainly in my field of work, which is surgery, yes, there is a relationship, unfortunately, because we see more motorcycle accidents that potentially can lead to traumatic spine injuries. Before I came to Rapid City, I was in Sioux Falls up at Sanford for 14 years. And during the bike rally, we would see multiple patients flown into Sioux Falls for need for emergent surgery. Now, I don't get to see all the things that they do, but they probably see an uptake in that as well with back pain that's non-surgical. But as far as from a surgeon's perspective, we do see an increase when there's this many people riding bikes, yes.
They come to town searching for a chiropractor.
Yeah.
For real. It is... You'll have just a huge influx of patients, and they're not sticking around for very long, but they just need work done. I mean, you take a majority of those bikers, they're doing the same thing.
I was just going to say posture.
Feet thrown out there just like this, riding for, oh my gosh, and a sustained position. Yeah. And even if they have upright posture, it's still rough on them. Yeah. I was talking to the patient that she was saying today she rode road bike over the weekend. And so it's sustained versus out mountain biking, and sustained pedaling creates cramping and tightness in your back because you're not sitting there moving and doing things. And so road bikers, just a static position gets them.
So I think that following in that same vein, we see overuse issues contributing. Where do we see that in the pain sphere, or most common?
Most common in terms of overuse that I see is patients just getting into a bad cycle. So they have back pain or SI joint pain, and they start to limp, or they start to favor the good side, and then they just get into this really bad cycle. Most of my patients have had pain for 3+ months, so I tend to see those sort of overuse cycles.
And of course, to go along with Dr. Ptacek, what he stated is that we see patients develop these bad habits, and yet they may not get them corrected soon enough, and so then that leads to a worsened posture, and then they have hip pain, then they have SI joint pain. Hip pain leads to knee pain leads to ankle pain, and now their posture's way off and their gait's abnormal. So it's one thing kind of leads to another, really.
The cycle continues.
Yeah.
A patient of mine recently came in and relatively young, but was having some pretty chronic pain. And just as I'm helping her, and I've got my gait belt, and I'm going, "Do you have scoliosis?" And she goes, "I don't know." It's like, maybe this was something that, had it been addressed at an earlier age, wouldn't have been leading to these problems in the early 40s. Is that something you guys try to get early care and maybe see better outcomes that way?
So you'll see scoliosis actually progresses between 1/4 and 1 1/4 degrees per year. So if they're starting to slump when they're in their 20s and they're shifting off to the side, you'll see that, and you can take regular x-rays and see that progression with them. And like I said before, awareness is number one. Mm-hmm. And then they get to start to learn, I need to lean the opposite way when I'm driving my car. Little things that build up over time just to slow it down, to stop it. And if it gets to a point, there's things that need to be done, whether it's exercise or traction, those types of things. It's super important. I had a family member come in from an injury 25 years ago, disc injury in their low back. Now their whole spine's shifted over. Now we're sitting about 30 millimeters off to the side. And didn't realize, and she brought in her black and white x-rays. Well, they're all black and white, right? Brought in her old school x-rays and put them up from a long time ago. And then I pulled up her x-rays, and you could see this huge change in her low back. And now she spends an hour and a half every single morning trying to stretch out and get to where she can move throughout the day. If the knowledge that's now was applied earlier in her years, it would have saved her a ton of problems. Yeah. And even though we were only able to correct 50% of that degenerative scoliosis, that 50% was enough to give her huge relief. So.
And I think one of the problems we really haven't touched on, and it's certainly important where we live, right, is geography.
Oh, sure.
Because we see patients from all over, eastern South Dakota, western South Dakota, Nebraska, Montana, Wyoming, North Dakota, that live in these small communities, and they may not have access to these types of doctors or other doctors that can give them the education, so they go longer than what someone in this environment would do, and so they don't get the appropriate care, which leads to progressive worsened problems. So I think geography is important, and getting the education and the message out there is really important early on.
I thought you were being more literal and like people mountain climbing and falling. Went hiking earlier today to beautiful countryside.
A lot of times you'll have ranchers come in, they're like, I'm in the middle of calving. I've got to see you today, and you got to get me back to work. I'm like, oh, okay. Yeah. We'll do what we can.
Let's talk a little bit. I know we've maybe touched on it, but degenerative disc disorders. How do these conditions cause pain, and what are some treatments that we see for degenerative disc disorder?
So I think of degenerative discs just as any joint in the body, because really it's a joint. There's cushion in between two bony surfaces. So just like your knee can have arthritis with a previous injury, or overuse, that disc segment can wear out very similar. So we have very common discs that wear out first in the low back. Typically it's L4-5. That's the disc that sits the furthest forward typically, and that's the one that takes most of the brunt with a lot of leaning forward. Degenerative disc disease happens to everybody. Mm-hmm. There's no way to prevent it, but there are ways to decrease the progression. And it's using a lot of the things we've been talking about tonight. So proper spinal mechanics, making sure that you're not doing things the wrong way. If you have pain, see somebody about it.
Yeah, nutrition. Again, paying attention to nutrition, your weight, don't smoke, proper mechanics. And then really the one thing we can't control is our genetics, right? We know that's related, but the other things, it's just wear and tear. And when we age and we get arthritis and we undergo degeneration of these tissues, your pain goes up. It's because of just the degeneration of the tissue.
I think some of the technology that's out there too, whether it's like Syndisc, being able to take and fill up the disc some, or even apply some of the technologies where it's strapping the spine into a traction device and doing spinal decompression. And there's a lot of new stuff that's out there that can help degenerative discs, because a lot of times it's not affecting the nerve and going pain down the leg. It's just local back pain, and you just want to get those tissues moving and healthier again.
Yeah.
So.
And there are more studies looking at that because it is such a big problem. And I heard a statistic last year that 80% of us will experience sciatica, pain shooting down the leg, or significant back pain, or pain in the neck and arm. And there's a lot of research going into it. So we're using a lot more regenerative medicine or orthobiologics to try to speed up the healing, to prevent the problem from worsening.
So as we get ready to part, I just want to ask you each, just very briefly, what would you say to a patient who's having back pain, when to reach out for help, and what are those first steps?
I think, for me, what I would tell them is, number one, do you feel comfortable and do you understand what your problems may be? Mm-hmm. And if they don't, I think education is important. Secondly, then we start what I describe as conservative and moving to more aggressive. So we talk about seeing the chiropractor, seeing formalized physical therapy. We do heat massage ultrasound. We use a light anti-inflammatory. These things are all very conservative and work for the majority of patients.
Yeah.
They will also help those patients. If they're not getting anywhere with their modalities, then they will refer you on to another specialist, like myself, for instance, if those things don't work. So it's up to each individual patient, but the best way to start is most conservatively.
So you're busy. I mean, all docs are busy, right? But being able to take the wrong type of back pain and put them in a neurosurgeon's office, if it's uncomplicated, like it slows down your office as far as it's not the first place they should be seen.
That's right.
And it's being able to know where to go in this pathway is important. And a lot of times patients are like, I need an MRI, I need an X-ray, and those in general they're important, but they're not the essential thing right away. It's a lot of times it's the chiropractic, the acupuncture, the physical therapy, exercise.
In the last
I would say for me, patients who benefit from seeing me as an interventional pain specialist are patients who have failed all the basic things.
Right.
They don't have weakness in the arms or weakness in the legs that would indicate a more severe problem, and they need to break the cycle. So pain's waking them up at night, they can't sleep. Pain's preventing them from doing basic things at home, taking care of their family, going to work. That's where we can usually insert an intervention to kind of break that cycle to get them back into more of a normal routine.
All right, well, thank you guys so much. We will be right back after this.
Overwhelmed with the amount of information available? Not sure which sites to trust? Head to the Prairie Doc YouTube channel today to access all previous On Call with the Prairie Doc episodes. And make sure to join us most Thursdays on SDPB or streaming on our Prairie Doc Facebook page.
Thank you to our guests, Dr. Ptacek, Dr. Gust, Dr. McIntosh, for volunteering their time to help us learn more about back pain. If you would like to see and hear more episodes of this program, please like and follow us on Facebook, Instagram, YouTube, and TikTok, or visit us at prairiedoc.org. Look for the Prairie Doc Perspectives in your local newspaper and online. Listen to us on Prairie Doc Radio, and be sure to look for the podcast of this program, Prairie Doc On Call, wherever podcasts can be found. From all of us here at On Call with the Prairie Doc, thanks for joining us for another episode of health information based on science, built on trust. Until next time, stay healthy out there, people. My name is Carter Holm, and I serve on the board of directors of the Healing Words Foundation, the nonprofit that runs Prairie Doc programming. Our mission is to enhance health and diminish suffering by communicating useful, science-based information respectfully and compassionately. Your donation supporting Prairie Doc programming makes an extraordinary difference. Gifts of any size enhance its impact in our state and beyond. Thank you for your generosity.
Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you, with care and coverage. Hello possibility. Hello healthy. Hello life. Avera, moving health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Ophthalmology Limited, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health,